Well, thank you all for being here this afternoon for the Scotland County Board of Health meeting on October 21st, 2025. This is a bittersweet meeting for all of us as well, with Amanda's news of retirement, and we will celebrate that here shortly. But I wanted to go ahead and get us kicked off. I'm expecting Dr. Hughes to come, but we do have enough here to go ahead and get started. Mr. Commissioner O'Neill, will you give us the invocation?
Oh, okay, sure. Heavenly Father, thank you for those gathered here. Thank you for the work that we'll do on behalf of this community. Help us to better understand the needs and how we can be an effective part of making our community safer and more healthy. Lead, guide, and direct us in your name. Amen.
Amen.
All right, you all received your packets,
Yes.
and I see you've got all your papers laid out in front of you. Are there any questions about today's agenda?
No.
Hear none, I make a motion to accept tonight's agenda.
Second.
Get a second from Dr. Singletary. All in favor, make it known by saying aye.
Aye.
All right, that motion passes. We're going to accept tonight's agenda. Looking back at well, hang on a second here. Approval of the October 2025 regular.
I'm thinking that was.
That's
No,
supposed to be August.
August.
Yeah, okay.
Yeah.
That's what I was thinking. Well, not crazy here. You all received in your packets last month's meeting minutes. Were there anything that needed to be discussed there? Alrighty. Hearing none, I make the motion to accept the August 2025.
I have an
meeting.
addition to I was present at the meeting.
All right, one tweak to add Dr. Hughes as an attendee.
Well, that's right.
All right.
And Dr. Kellum was here too, right?
I was, but my name is spelled wrong. I don't know if that makes a difference.
All right, we'll make that tweak. We'll make those two tweaks. You got that, Kiana? Thank you. All right. Well, I will make the motion to accept the minutes with the tweak of the spelling, Dr. Kellum's name, and the presence of Dr. Hughes.
I'll second.
And we get a second here from Ms. Bean. All in favor, make it known by saying aye.
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 Alrighty, that passes unanimously as well. We're now going to move forward into the public forum section of our agenda. Is there any members from the public here that would like to speak tonight? Alrighty. I saw a lot of eye contact being broken from my gaze when I asked that question, so I think that is enough. All right, we're going to move into the departmental updates. We're going to get this kicked off with Mr. Martin to give us the fiscal updates.
Good evening. I do want to start off with some really good news. I don't think these things are on there, are they? You should see a piece of paper in your hand that says Blue Cross Blue Shield, Jonathan David Rosen. I know we had some issues previously about some, and I know Ian and several board members have talked about us losing our Blue Cross Blue Shield credentialing for probably 2 months, maybe. And then we were able to get up with the hospital, and the hospital was able to add us back on to their plan. However, I do want to recognize one of my employees, Dora Taylor. She's worked really, really hard, Blue Cross and Blue Shield, since she's been here, and she was able to, for us to the health department, to get our own network contract with Blue Cross Blue Shield. So, and we have been getting paid
Okay.
as usual, and I can thankfully say we are actually getting paid for services that we used not to get paid for Blue Cross Blue Shield. Used to be family planning. We were not able to get that, but we've actually received 10 different payments for family planning services. So I am thankful that this network is now in place, so maybe we can provide more services to Blue Cross Blue Shield insurance, people with insurance. So that's a bit of good news.
Wonderful. Thank you.
It's been a journey. I've been here 14 years. We've tried to do this for 14 years. I've been here. So it's finally, not sure what happened after 14 years, but it finally came to pass. So I'll thank her for her hard work and getting it all done.
Can you thank her on the board's behalf as well?
I will most certainly do so. Yes, sir. So I will go into the financial update for, as of September 30th. As you can see on the expenditure sheet, 3 months, 25% expended. This is the first quarter of the year. As a total health department, we are under budget by 4.4%. You can see there's a few places where we are over budget, but that is because that is the places that we are, where we pay stuff ahead of time, and then later on in the year, it gradually goes by. Any questions on that? And the next page will be your revenues. You see your state revenues, which is your grants, your Medicaid revenues, and then your fees that we actually collect at the health department. Once again, 25% collected. As you can see, we're at 22.3% collected, so we're not too far off where we need to be. Any questions about those numbers? I'll give you a moment to look over. I will note the immunization number that you see that is at 17.9%. That number is going to jump dramatically, probably next meeting, because I told you those Blue Cross Blue Shield stuff that we had sitting there, we went back 2 months, and we've gone back 2 months, and they've paid 2 months back of stuff that we've had sitting out there. So it's, that number should go up from there.
So, question, with our labs to go, like,
Ma'am.
we usually don't have as much, like, above. Do we know, like, which labs are people really, like, using right now?
I cannot technically
Can't
say.
say?
I can't say. I'm not sure exactly
Okay.
what
But
those.
It's somewhere that we making more money than we have anticipated.
I do know that we are offering more different types of labs now than we have before. So once that comes to being and someone says, their doctor says, can you do this lab? And LabCorp says, yes, we have it, then we can add it. We did have a conversation with Dr. Armstrong's office about trying to do some lab work for him. Unfortunately, there was some things we could do for him. Some things were a little more difficult. It means you had to wait this long to do this. You had to be this temperature. It had to be done. So, but we do thank them for reaching out to us to actually see if we could participate with that. And we will.
So this is coming with like some collaboration with offices that need specific labs.
Correct.
And things. Okay.
And we actually have someone who works at Dr. Armstrong's office, used to work at the health department, so she knew the Labs to Go program. She actually inquired if these labs could be done. So we're thankful for that.
Okay. Thanks.
Any other questions on that? And the very last sheet, which is all those two sheets put into one, basically tells you per the program, the expenditures, the revenue, and what the county up at this point has put into operating those programs. I will draw your attention to the TB line where it says negative $4,706. That's because we draw down monthly allowances from the state through that grant. However, at this time, we do not have a TB nurse, so there's no salary that comes out of that line item. So that's why there's no expenses in that line. That's why you see $86 in expenses in TB, because we don't have a TB nurse at the time.
Who used to be our TB nurse?
Paige McInnes, Elizabeth Paige McInnes.
And then Donna.
So like on our paper, I'm sorry, because you sent this out, because this is me trying to figure stuff out. So you sent us this organizational structure thing. So
And it's changed since I sent that out.
Oh, so where's the TB nurse on this?
She would be under the
List. She would-
PHN supervisor.
No, PHN 3.
Yeah, I'm the PHN 3, but her supervisor, she would be underneath the.
Oh, so the Alyssa Freeman underneath her, the PHN 3 that's vacant.
one's frozen and one's vacant.
Okay, so that vacant one that we say with no TB nurse hasn't been there since 24?
Yes.
Okay, so that,
Now, the person that was previously in that position works contract like 1 day a week. She's come back and,
But
she comes
Paige
back and works 1 day a week,
uh-huh,
outside of her other job duties. So she does come and assist when she can.
when she can.
However, according to our agreement addendum with the state, that's not sufficient enough. You
Okay.
have to have someone that is checking NCEDS, which is our surveillance system daily, and following up. Just last week, we had hand, foot, and mouth outbreak at one of the schools.
Mm-hmm.
You know, you have to have someone that's following up on it daily.
So when we say TB nurse, we mean like communicable disease, not just TB.
Not just TB.
Not
Yeah.
just
So
TB.
communicable disease nurse.
But part of their salary comes out of communicable disease and part of it comes out of TB.
TB, so that's how,
Yes, ma'am.
yeah, but it's the communicable disease nurse.
Correct.
is
I'm
that
sorry, I
position.
should not said TB nurse. I should have said communicable disease nurse. But part of their salary comes out of each line. So,
Yeah. All right. Finance wise, on your paper, it is right, because it's TB nurse and communicable disease pay her salary, so,
yes, ma'am.
but, yeah.
Any other questions?
Can you expand on the two red lines for social work services?
So what that is, let me explain this the best way I know how. The managed care systems, the managed care, Medicaid managed care programs will send these two programs, which is the CMARC and CIMHART programs, which is our social work programs. They send us monies for ever how many children they think, or pregnant ladies they think that they will see at a certain period of time. That money comes into us sometimes behind schedule of where it was, so therefore, they've sent money in for last year that can't go back to last year. That's why you see that number is greater than the expenses. Because there's about a month in there that we got checked for that didn't go back into last year because this year was closed. Last year's books were closed.
Okay.
So that's why it looks like they're made money, and they actually, those two programs actually fund themselves mostly. It's probably about 90-10, about 90% of their programs funded by Medicaid and 10% maybe by the county. It used to be totally Medicaid, but at this point in time, it's all 100% funded because we're down to social workers. So therefore, that's why there's not that salary coming out of there either. So, well, one social worker now, but we're down two.
So we have one social worker for both of these.
We
Okay.
actually have four.
Four?
We have 4 social workers, and one is vacant at the time.
And one of those we just hired,
And-
but
Yes.
there's so much training you have to do before you can actually carry a caseload.
And basically, I can't explain those programs all the great while, but Amanda can because she's been there. That's what she used to do before she came here. Basically, the Medicaid gives referrals for pregnant ladies that need to be carried, followed along, and anyone from 0 to 5 that goes to the emergency room, for example, that does not have a PCP, they follow up with them and they follow them through for a
Or
while
if they
until.
have like asthma or anything that puts them at a at-risk condition.
Any other questions? Okay, so we'll go on to the next part. Try to see. Last month, 2 months ago, I forget, not every month, we talked about debt set-off and how we wrote off our bad debt. So tonight, I want to speak with you just briefly about how we write off or what we do with charity. And I got some definitions written there for you to explain to you kind of some of these terminologies. Charity is the amount adjusted off charges for a patient visit when income is assessed and meets requirements for the agency's sliding fee scale. You have a brochure here that I gave you. It looks like this that says sliding fee scale. This is the brochure that we give out to clients and to events we go to. Basically, And the sliding fee scale is scale on which charges are adjusted when assessed income that meets requirements of the 101 to 200%, 250% federal poverty level. So if someone comes in and does not have insurance, we assess their income based on that poverty scale. And that's when you will see on the next page we'll get to in just a second where their charges are reduced based on their income. As a health department, we're required to see everyone, no matter if they have insurances or not. I'm sure you're all aware of that. So, but this sliding fee scale is what makes that possible. And this sliding fee scale from the poverty level comes from the state and the federal government, so it's not our level. They're the ones that decide that information. I'm sure Dr. Singletary is aware of that scale. So, also Title 10. Title 10 is a grant, a federal grant that we receive as a health department to offset services that we provide for patients who want confidential services. Confidential services means they come in and they don't, I'll give you two examples. A lady wants to come in and she wants to get on birth control, but she does not want her husband to know. Confidential services, we consider them a household of one. We take their income of that household for one, and then we use sliding fee scale to decide how much they actually owe. Second example, because we receive Title 10 funding, if a 14-year-old walks in our building and wants birth control but does not want her parent or anyone to know, as an obligation as receiving Title 10 funds, we have to provide services for that patient because we receive these funds. Any questions on that? Now, they are very, 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 very persuaded to let somebody know, but we cannot say you have to know. And a lot of times people will come in and they don't, and we'll talk about that second. Next one, confidential services. Services provided that the patient requests no insurance to be billed or mail to be received. For example, I have insurance, so someone has insurance, but they're coming in for STDs. They don't want their parent or their husband or whoever else has on their insurance to know that they went to the health department and got STD services. So if they ask for their insurance not to be billed as a health department from the state requirement, we have to honor that. So, and the reason I'm saying all this is because you're going to see on the very last page what this all means. So, any questions on that part? So the next piece of paper is actually the sliding fee scale. You will see family size of 1 all the way down to 12, what the federal poverty level is for that family size, and you'll base their income, how much they actually owe based on where their income falls into these categories. It can be anywhere from 0 to 80% to 100%. Some people come in and they have a great income and they have to pay 100%. Some people walk in and have no income. I will say this, we are very proactive about saying if you say you have no income, how are you living? Someone in your household is paying for you to live. But then again, if they come in and say, well, all they've got to say is I want confidential services, then, we're back to family of one and they have no income. So we do try our best to gather as much income information as we can, because if someone is coming in and live with their parent, somebody's paying their bills. But then again, they don't want us to know what their parent makes because they don't want the parent to know that they're there. So, any questions on that? So the very last part, which is what I just need you all to agree to, is you'll see where it says charity adjustments. These adjustments are basically services that we provide that we don't get paid for. I can just basically say it that way. So STD services in the past, in the FY25, we performed $39,083 worth of services that we did not get paid for because they requested confidential services or because they requested that their insurance not be billed. So when they went through the end and our medical biller got it, she zeroed charges out. Same thing with family planning and maternal health, HIV as well. Any questions on that first column? Okay, the second column, which I told us a little bit about the Title X monies, and there's Healthy Mothers, Healthy Children. We do receive money from these AAs or through these federal grants to assist us with providing these services for people who are underserved and could not pay. So you'll see, as for example, family planning, $20,750, and for maternal health, $9,400. This is to offset the cost of us doing that sliding fee scale and for the zero charges. Any questions on that part?
Should the actual adjustments column for HIV be 2,777?
Yes, I'm sorry, I apologize. Yes, that's correct.
We're paying attention over
I
here.
thank you. And I looked at this thing like 3 times and totaled it up like 3 times. So, but yes, that's correct.
So is there no funding? So evidently there's no funding to help with HIV, right?
Currently, at this time, that is a program that is not required by the state for us to provide. That is a program that we provide as a, have always provided as a, just a benefit to the community. So what happens is someone comes in and they have insurance, but we do not take their insurance. But we try to give them somewhere else to get their primary care done there. However, there are instances where that cannot be done. So that's where that entails and lies. But that's not a usual thing for HIV HIV patient.
For frame of reference, do you remember what fiscal year 23, 24, does this number stay pretty consistent, or is this tracking up or down?
I cannot give you exactly that information.
Okay.
I don't have it. I don't have that with me. I will say STD pretty much stays the same, around that 39, 40, because that's the biggest service that we provide at the health department that's at no cost to no cost to the patient. I don't want to say free, but it's no cost to the patient. And therefore, the county provides those services and does not receive any funding for it. Because that is one of the mandated services of the health department, is to provide CD and STD services. So,
Question.
Yes,
So
ma'am.
with the HIV funds, I know last time we were talking about like the Ryan White funding and all that. Would any of the funding that if we had it from there, would it help offset these, or is this stuff like not included?
this
in the
falls in
Ryan
between the cracks.
White? This is that falls in
This
between
is
the
the
cracks.
fall that falls in
of-
between the Ron White and the insurance. I don't want to get too far in, but we have some people whose insurance changes every 6 months. And so what happens is we bill and we go back and we bill, well, their insurance was changed. We saw them. We didn't know their insurance had changed. They still had their old insurance card. We tried to verify the insurance and they said it was there. And then all of a sudden we get it and they deny it.
Okay.
And when they deny it, instead of passing along some of the costs back to the client, we just go ahead and write it off. So actual adjustments is $51,400. That is the amount of services provided by Scotland County in FY '25 that we did not get paid for, did not get funding for. So that's basically a write-off. So that's what I need approval.
Quick correction,
Yes,
because I re-added all the
Yeah,
numbers.
I'm sorry,
It is
51,400 plus the 27.
51,425.
Yes, ma'am.
So it's 51,425 is
Correct.
the final number with all them, when we add the 2737
Yes, ma'am.
into the number.
So it should be, so that should read what?
It should say, it's just $25 off somehow.
Okay.
When you add the 39, the 9, the 150, and the 2737, it comes up to 51,425.
You confident in that number for us to vote?
Well, the 2737's got to move over. Did we move that over?
Yep, I moved it
Okay,
over.
all right, thank you.
All right.
That is weird.
I'll do it 3 more times.
I just hate for us to vote on, it'd be $1 off.
No,
We're good.
we good. Since
So
we already
moved.
closed it out.
Move to approve?
Yeah, make it, we got a motion to
Yeah,
approve
motion
that.
to approve $51,425 for charity adjustments.
Second.
Dr. Hughes is seconds. All in favor, make it known by saying aye. Aye. Unanimous pass there.
Okay, thank you. Any other questions?
Thank you for
All
that
right.
breakdown. That was very helpful
right.
in
You're very welcome.
building up the storyline to get us to the point.
Yes, yes.
make
I'm
sense of it
trying to
all.
get you to the point where you would understand what that last quote was. And it's not like we're I can't say losing money, but we're required by the state to provide these services. And that's just one of the things of having a health department, so, to provide services for the community. So, thank you so much.
Thank you.
Thank you.
All right, moving ahead on the agenda, environmental health.
I don't have any updates.
All right, no updates. Easy enough. Amanda?
Yeah, I'm gonna stand up tonight. Come over here with my family. So you probably noticed in your packet, I did not include a health director's report this time.
Amanda,
Mainly because,
Can I ask one question real quick? Tim, you had a approval for updated fiscal year 26 immunization you needed action on? You're good there?
I did not get that information
Okay.
in the packet.
All right, I wanted to make sure we didn't.
So it's gonna be moved to the next meeting?
Would that be a next meeting item? Okay. Thank you.
okay. So, there was not a health director's report in your packet. There's really not been a whole lot of changes except for vacancies. So you will see the organizational chart in there with different things highlighted of the vacant positions, and that has even changed since I sent it out. I mean, that's our biggest issue right now. So I would like to express my sincere gratitude to the Board of Health, my dedicated staff, and the citizens of Scotland County for the opportunity to work alongside you in strengthening our public health system. Public health has always been a passion for me. It touches everyone, whether it's the air we breathe, the food or water we consume, and then the prevention of any kind of disease. So it affects all of us. A lot of people don't realize that. And I know even when I was growing up, I used to think when people said the health department, I was like, that's where you go get your shot. It's much more than that. And so public health has always been my passion. During my time as health director, along with my wonderful staff, we have been able to secure multiple state and federal grants that will directly benefit our community. These include funding to support reproductive health, HIV PrEP program, infant mortality reduction, and vaccine equity. Each award represents a shared commitment to improving the health and well-being of the citizens of Scotland County. While we celebrate our success, we would also like to acknowledge the ongoing challenges of staff vacancies across several key programs over the past year. Filling these roles is essential to sustaining service delivery, meeting grant obligations, maintaining accreditation, and addressing our community health needs, as well as what Commissioner O'Neill has expressed numerous times, being able to provide that outreach to the community, bringing it to their doorstep. Over the past year, approximately 20 to 25% of our positions have been vacant at a given time. This sustained vacancy rate has increased the workload on remaining staff, contributing to burnout and diminished morale. We have also seen a rise in sick leave and FMLA usage, with 10 to 15% of our remaining staff either on FMLA or they've exhausted their FMLA or sick leave. Although North Carolina Statute 130A-41 assigns the health director responsibility for staffing the health department, my ability to act has been constrained. I have requested job postings, recommended hires, and sought adjustments to salaries, but these efforts have not yielded results. As we move through this transition, I urge county leadership to prioritize recruitment and retention and to ensure staff have the capacity and support needed to deliver the essential services to the residents of Scotland County. Like any profession that requires proper tools to get their job done, whether you're a carpenter or a plumber, you know, there's certain tools that you need. The health department must be equipped with the fundamentals. They need adequate staffing, competitive compensation, training, and equipment to operate safely and effectively. In closing, I want to express my profound gratitude for the dedication, professionalism, and compassion exhibited by my staff, and this is just some of my staff. They work extra hard to try to pull up that workload. They constantly strive for excellence despite many challenges they encounter each day. To the board members, thank you for your invaluable guidance and encouragement. Forever, my friends. To the community, I extend my heartfelt appreciation for all the trust and support you have shown me over the few years that I have been here as the health director. And I will always cherish these relationships. Thank you.
Thank you, Amanda.
Thank you.
Ready?
Huh?
We're good?
Yep.
All right, moving to old business. We're gonna
I guess
go,
that's gonna be what we got questions about.
yeah, do we want to ask any questions before we move ahead on the agenda on the org chart for our own benefit here to understand the current status? Would
This
that be
is the
appropriate?
org chart that is gonna be like submitted to the, like in the accreditation,
Yes, it has to be submitted.
like this one right here, right?
The second
Yes.
page or?
So which one
First
are you
and
looking
second
at
page,
first?
right?
The,
Cause the first page is in like environmental health. It doesn't have the stuff for, like, one is, looks like nursing and the other one
the back
is.
one is clinical.
Okay,
Now,
clinical.
the one submitted for accreditation is not gonna have all this color coded. This is just for you guys.
Yeah.
Oh, okay, okay.
So there has been some changes. If you look at the first one with the clinical services, of course, I'm gonna be leaving October 31st. We have had the director of nursing vacant since August the 8th. On the next line, we have 2 part-time nurses, but Elizabeth Page McInnes, who fills in for TB and
Oh,
CD,
that was a TB. Mm-hmm.
she may get 8 hours a week is about all she can squeeze in, and some weeks she doesn't even get that in for us. The public health nurse supervisor too, Elisa Freeman, she's actually leaving the day before me. I think I mentioned the last meeting that there was another nurse.
She had.
So that actually brings us down to only 3 nurses, where we did have, 9, counting the director of nursing, something like that. So those 3 are really stretched thin right now.
So, what's that gonna do for the state statute of requirements for the health department?
Truthfully, it doesn't look good, because number 1, you've got to have a lead nursing administrator. And that has to be a nurse,
And that's state statute, correct?
Yes, and it's also in our agreement addendums for us to be able to pull that funding down, as Tim was talking about. You have to have a lead nursing administrator. So as of the 30th, we won't have a director of nursing and we won't have a nursing supervisor.
So, the consolidation does not change the state statutes as far as the health department is concerned. The state statutes stay the same whether we have a consolidation or not.
Right.
Isn't that correct? Okay.
Right, when it comes to nursing.
Yeah, okay.
Thank you. And on the line with the social workers, we have filled one of those positions, Latricia Epps. Felicia McCall was one of the ones that's been out on FMLA, but thank God she's back.
Okay.
So we only have one vacancy right now. Well, actually, Ms. Sharina was out on FMLA too, so the two social workers that are seasoned social workers right now have been out on FMLA, but they're back. The next line, the lab, there's 3 people there. The middle one is out on FMLA currently. And as far as the providers, we have 1 full-time provider and 1 part-time provider that's being filled by a contract worker. Okay. Any questions on that part before we move over to
My
the-
question, so of the 3 nurses that we have still on staff, how many of them will be qualified to be lead nursing administrator in the absence of the other 2 nursing supervisors and directors?
Only one of them would qualify, and the county manager is currently working with her but has been made an offer for that position, but she has not been willing to accept it at this point.
And credentially, she's the only one eligible.
She's the only one.
And that still doesn't fill the need for the TB and CD nurse, because neither one of these 3 have had the formal training
Training
that
to
is
be-
required by the state. Any other questions on that page? On the front page, we have, under nursing, we had 1 employee that just started, this week, and we have 2 vacancies there, one of them frozen and 1 vacant since September 15th. And we have a public health educator position that's vacant, and that is the one that is for the grant that I secured, the Supporting Women's Health grant. And so therefore, we haven't been able to draw down any money or really do anything with that until we get the educator person hired.
How much
That's
was
the
that
one
grant
that we
for?
were working with St. Andrews on, and then St.
Oh,
Andrews
okay, then it's closed down.
and the public health educator we had left about the same time.
Okay.
And so until we get another educator in that can go out and beat the pavement and, get us some more things going with that.
Okay. So we had the program ready and running,
Yeah, it was
Just
up and running.
ran some, okay.
Any other questions under org chart?
Commissioner O'Neill, I'll give you a segue to the next point on our agenda.
Okay.
So the consolidation efforts to date, it will happen, really, this org chart just adjusts what is above the primary line of responsibilities.
As far as I know. And we'll let the new person get aboard and work through all of that. But right now, I'm not aware of what's below that line, so.
Okay.
Just some updates I'd like to offer. Amanda Holland comes aboard at the end of the month, and she'll have a couple of days with Amanda Deaver, and they'll do some handovers. We go from Amanda to Amanda. We have to always make sure that we say the second name. We will be hiring a health department director in the future because we didn't anticipate that we would need to, but now that we do, we will take that action. We are working on a communicable disease nurse hire or coverage plan. We're aware of that, and the county manager's taken that for action, and that's going to be high on the priority list for Amanda Holland. We are scheduling training for commissioners so that they're prepared to discharge their duties as required, and we're working with the School of Government on that right now. And Amanda Holland will be reaching out to board members about the advisory board in the future and service on that board, so people can expect to hear from her and get an introduction and have a conversation around that.
I know we've currently have a scheduled meeting in our current format for December. Should we tentatively hold that date?
I think we should hold that date. I wasn't sure if we went dark during December and skipped to January, but if there's a December date, let's hold it in December. And I know for me, I'm pushing commissioners, let's get trained so that we're ready when the board's ready and we can take the actions that we need to take to help. I can tell you this hiring issue is going to be number one, number two on our list. I mean, we are going to aggressively work this. There's just no other way around it. And that's my commitment, is to make sure that we're doing everything humanly possible to get qualified people in these roles. So we are going to turn it on.
Thank you. Any questions? General consolidation questions?
No, my question's about these policy stuff.
All right.
Okay, thank you.
Thank you, Commissioner O'Neill. The next part of our meeting, last meeting, we spoke about a drug or supplement. I'm not exactly sure what to call it right now, but Dr. Hughes agreed to, or volunteered to write a letter on behalf of our board to make a plea to the county commissioners about this substance and the proximity that it's being sold to our high school. I'll give you all a moment here to read this. The goal here would be that we could unanimously vote this forward and recommend that it be presented to the county commissioners on our behalf. And I understand this is the first time we're seeing this, so please take a moment. All right, everybody good there?
I really, to say, I completely agree, and I'm glad you took it to write it. It synopsis everything I would want to say, and even probably some less details, and the importance of it. I will say, to be on record, is like more aware. I just attended like the American Academy of Pediatrics conference, and we had at least 3 sessions on high potency THC products, and the combination of those with nicotine were multiple things that are issues across all of the U.S., and the consequences and things that we're learning about what we do know it has on the teenage brain as it's developing, and everything, not just with this Crampton 7, because it's one of the newer ones that's out. So I fully agree with this being sent to our commissioners, because this is our first step to making sure that we are being active protectors of our youth in our communities against things that may come in that can be legal but still harmful. So,
Thank you.
I love it.
On August 1st, after hearing Catherine Cox talk about what happened with this individual in this Kratom 7, I reached out to Danny Britt's office to see if the state of North Carolina was contemplating any action because this particular substance has made the national news. There's no doubt about its dangers and all that. And he's responded that the Senate has passed several bills to regulate this substance, but nothing has passed in the House. So the state of North Carolina seems not to be able to get on the same page to pass some controls on this. So I completely agree. The content of the letter is great. I think but the alarm has been sounded. My question is going to be at the commissioner level is what ability do we have to actually control this in some way? I mean, with ABC, they have people that go out and check and try to detect underage purchasers of alcohol, and they regulate it. I don't know what's happening in these smoke and vape shops. I don't know if our local police force would be involved in that. I don't know if the sheriff would be. Probably not, because they're not drug agents, so to speak. So I think our biggest challenge is trying to find an enforcement mechanism, because you can buy these substances online and have them shipped in without ever walking across the street and buying them. So I say all that to say that, I know you're looking for some decisive action, but I'm just not, that's just what the groundwork looks like. And I had hoped that the state would take some action because they do have the enforcement mechanisms and they can say, you will not sell it. I don't know that we do in the county. And when I brought this up to the commissioners, I think that's where we kind of landed is we feel like we don't have any levers that we can move. Now, could this be added to the educational curriculum at the high school for like DARE or for their opioid program to let people know, hey, it's not just opioids, it's not just fentanyl. Look out for things that are being sold as health supplements. Because if you read about Kratom 7, some people will tell you it's good for your well-being, even though all these things happen. So I know that's kind of a long comment, but that's kind of where we're at. So that's the challenge.
So what kind of pressure could the county commissioners, as representatives of our community, put on the House
Push.
and say, look, the Senate's done this, what's going on with you guys?
Yeah.
I mean, and sharing that story that Kathy shared and say, until you guys move, we can't do anything to help our citizens.
And
Yeah.
you can use that. Our own county's Board of Health has come to us
Yeah.
for assistance in this matter that is raising concerns in our community, which now is how you get that onus onto them, because they're going to say, well, we didn't know it was that big of an issue. Well,
Yeah.
now we have an official letter from
Yeah.
the Board of Health coming to our elected county officials who are now saying, we've already reached out to our senator, who now
And-
is telling us this. And even though, this is just like my saying, like, even though I know we're saying we may not be able to say, hey, take it off the shelves tomorrow, but somebody has to be the initial actor to push for the change we want to see.
Maybe we're the
And
first.
so why
maybe-
can't Scotland County's Board of Commissioners be
Yeah.
the
I mean,
pushers?
I reached out to Senator Britt before there was ever a letter, when it was just a story being told.
Yeah,
So
I'm
there's,
it's just.
but it's not a lack of advocacy. And the fact that a group of senators passed it through the Senate tells me that we're not the only one and people know. We'll be happy to reach out to Garland Pierce in the House and say, Garland, can you help me? But when I sent this note to Danny Britt, he didn't ask me what is Kratom 7. People know.
Yes,
They
we
know
know.
across the nation.
Yeah.
So I'm happy to reach out to Garland Pierce. We'll reach out as a board. We'll add probably a letter on top of this letter, or we'll add some sort of action, whatever's appropriate that they'll agree to. We'll certainly do that, because this story says everything we need to know.
Stories are what get legislators' attention.
Yeah.
And so sharing the story with the background, that is how you get their attention. And that's something, that's what I'm saying is, I'm not saying that you guys haven't been actionable. What I'm saying is you guys are our voice. And so this is our plea
Sure.
for you to be our voice. And now you know that when you're speaking and having that voice, that you're not just speaking for a few, you are speaking for all of those behind you, that it's not just my personal request. No, this is my constituents are requesting.
Sure.
And you can, when you do that, when you're talking to them, you can do it with a clean, clear, strong heart, because that's what we've asked y'all to do.
Yeah, I fully support it.
Yeah, if the weak link right now is the House, if you guys can pass our letter along with yours to Representative Pierce and say, hey, the Senate's already come on board here. What are you guys going to do?
Yeah.
And then that's all you can do. But now you've done it. You know what I mean?
Yeah.
So I mean, at least you know where the weak link is.
So we've got half of it done. We'll do the other half.
Excellent.
Appreciate
Thank
the
you.
legwork you've
Yeah.
already put in and you're going to continue to put in.
Yeah, because,
on that.
we don't, some things are just true on their face, and this is one of them, so.
All right. Well, I'm seeking a motion here to adopt this letter as one of our own from all of us as a board, and to
I make a
send this.
motion that we adopt the letter about the availability of Crampton 7 to be submitted officially to our county commissioners on behalf of our Board of Health.
I'll
Second.
second that, ma'am.
we got a couple seconds there. Dr. Hughes, I'll call yours. All right. All in favor, make it known by saying aye.
Aye.
All right. That passes unanimously.
We'll get it on the board meeting agenda for November.
Thank you. Dr. Hughes, thank you for preparing that, drafting that up. All right, we're going to move ahead here to the new business, strategic planning update and approval.
Good evening.
Good evening.
I'd like to provide a brief update on our 2024-2027 strategic plan. Over the past year, our team has continued to make some measurable progress towards the goals outlined, focusing on strengthening community health outcomes overall. You did receive the strategic plan in your packet prior to the meeting, and I'd also like to note that our health director has structured the Board of Health meeting health director reports in a way that you got quarterly updates on our strategic plan. So I won't stand here and rehash what you've already been receiving regularly. And a full summary of the strategic plan updates have been included in your packet, like I said. When you look at that, you will note, of course, the only update is fiscal year 25, calendar years 2024, 2025 is what we've been working towards so far. Pause to give you a moment to find it if you haven't already. Sorry. With that said, at this time, I do submit this report for the board's approval. Of course, in support of Accreditation Activity 15.1, providing evidence of annual updates and implementation of the strategic plan. And this is annually since our previous site visit. Before I pass that on, Board Chair, are there any questions about the strategic plan or our progress?
No, I like the way that you have it set up so that we can see it from like year to year. This the first year of the new one, so you can't really see the progression. But I do like how that has been set up and how you've kind of been specific with measurable things to show how you've tried to work and accomplish each one of those tasks that are set in the strategic plan and things that need to be done. So I want to say thank you because I know it does take a lot of work to be able to put everything that everybody does into one 15-page document, okay? To make it also easy to understand and be able to pull out the nuggets quickly. So I thank you for that, the time and effort, because I know it does take all of that. Which means that somebody has been keeping documentation of the things you do because you were able to pull it together. So
Thank you so much.
yeah, I read it all at my house already.
And so you're seeking
Just approval of the addition for the stuff for fiscal year
approval of
24?
the update you've made?
Yes,
and
approval of
then-
the updates.
Okay.
All right. So, has everybody read it?
We all good, board? Any questions?
So, all right, I'll make a motion that we approve the new strategic plan with the added information for fiscal year 24, 25.
And I'll second that.
Ms. Bina seconds. Alrighty. All in favor, make it known by saying aye.
Aye.
All right. Thank you.
Thank you.
Next on the agenda is annual review and approval of policies for accreditation. Ms. Beaver?
So the policies were included in your packet. There was no changes from the previous policy. It's just that we have to update them annually and get them signed for accreditation. I know there was some questions about like the standard operating procedure and different Board of Health stuff. But these policies take us up through October 31st. Anything, because the dashboard will close on November 1st for this accreditation. So anything after November 1st with the consolidation will go on the next accreditation.
And so all the references you see of health department,
Yeah, so, because that's one of my
Consolidation is
questions. Yeah,
irrelevant.
one of my question was about, on here, because it said like approval for like, appointing the health director, was that it was the, like in the bylaws, said that it was like the Board of Health's, job to appoint the health director. But now that we know that this will be pre-consolidation, all of those policies hold true for December 31st before. So these can all still be approved and included in accreditation and uploaded to the portal with the signatures. I did have one question though, and that's just because I think it's a change and I don't think we really even paid attention to it, that in one of these, it tells us that the health department, like the in-network providers that we are approved to be in-network for. My question was, have we looked at making sure, or that we start the process of becoming in-network with state Athena? Because Blue Cross Blue Shield is who used to have the state contract, and so all state employees, so all our teachers, all of our people who work for the state were under Blue Cross Blue Shield, and they could come here and bring their kids here for vaccines and services. But now all of those people are under state Athena, and we are not in network with state Athena. So we need to.
Athena?
Athena, yes. So we need to work on becoming in network with state Athena so that we can provide these services for our teachers and their kids and all of our state employees, because right now, all of those people are gonna have to go out of county, because from my understanding, Scotland Memorial also is not in network with state Athena, so they cannot go to the hospital here with state Athena.
So do we need a separate accreditation for county employees since we're not under Blue Cross Blue Shield?
It may be that might be what the problem is. If it's not Blue Cross Blue Shield, if y'all need to be in network.
For county employees, I'm sorry, for county employees, are we Blue Cross? I mean, I don't have it, so we are Blue Cross Blue Shield? And I guess we'll be automatically migrated, or
So,
We are not, because this is state employees that she's speaking of.
Yeah, no, I'm talking about, we're in Blue Cross Blue Shield, how we just got this with Dr. Rosen. Will that now include?
What we will have to do is, Dora, who I spoke of earlier, she will have to get information to try to get credentialed with,
Athena.
Miss Athena.
Uh-huh.
And she will have to fill out the paperwork and put all the information, just like she did with Blue Cross Blue Shield, and see if we can get in network with him.
Okay,
That process will start.
okay.
Yeah, because it can't take 14 years,
Yeah,
right?
But I will tell you, the process for Blue Cross Blue Shield took us 60 days.
okay, once you finally,
yeah,
okay.
it does take a little bit.
60
Okay.
days to return our email, and they didn't return it, then we called them, and they said, oh, it's sitting in the queue.
Yeah.
Nobody's looked at it yet, and if we wouldn't have called,
Yeah.
they long how in the pocket.
Part of the issue is going to be that everybody, all the providers, are looking to get that sent through for them as well. Because each office would have to do that, each practice.
Yeah, so that was one thing I saw, and I was like, Athena's not on there, and that just switched in August, I think.
As long as we're talking about this, what's the program? I've heard it at Scotland Memorial where there's a bucket of money to cover certain services for people who are uninsured. What's that program called?
We don't necessarily have a program like that here at the health department. Basically the sliding scale fee, what I told you earlier. And
Right.
it's money that comes from the state, but we draw that money down from the state, on a monthly basis. But we
But-
don't have a separate pot of money.
Well, apparently the state has a pot of money that they have, and you can get like a scholarship, or you get enrolled in this program and you get, let's say, $2,500 worth of health services that you can use that at the hospital, and you're treated as if you're insured, right? I mean, with that amount of money. I don't know the name of the program, but I wonder, is it possible for us to be a beneficiary if Scotland Healthcare System can be paid for those services? Could we likewise be paid for those
Talking
services?
about a patient applying for that?
Yes,
Patient would
community
apply for that.
health, population health at Scotland Healthcare System, they enroll people, and I think they've enrolled 200, was a number I heard about 4 months ago. So I can see people enrolling in that and going to Harris Family Practice and receiving care rather than perhaps coming here and receiving care, right? Because we've talked about the stigma and all that sort of stuff. But if I could go to Harris Family Practice, why wouldn't I, right? A lot of just convenience and blah, blah, blah. But if you wouldn't mind, would you just see if that's a program where we could somehow participate and be reimbursed for some amount? And I think it's a difference for the patient too. It's like they have coverage for a certain amount of services.
For the person.
No, I don't. Population health,
I was like, I can't remember the name myself, but I think that one of the things is the people, they can use it, and they can use it like you are approved for that amount of money as a patient.
right.
And it's kind of like, for lack of a better comparison, kind of like they get it's like they're a FSA card, right? Like a FSA card. So they can use this like FSA or flexible spending account, right? Where they need to use it for their health services, whether it be prescriptions or doctor's visits. And they can go and use it where they need to get their health services from. I think that with that, I think inherently they could use it at the health department to pay what we would charge
Exactly.
for their sliding fee schedule, right? And they could use it there because our system's already kind of hooked up to be able to accept like FSA, HSA cards. But it's about, now this would be where you would want to publicize that you could pay for those services with that card at the health department. Like the health department, just like people say they accept care credit, right? So it's basically like a care credit, but not.
But through the state.
Yes, they don't. It's a different, they have a different healthcare credit system. And that's another thing that we would have to look into, especially with the health department, is because it will vary because of the things of how we operate and stipulate, like because we are a state and we get federal and like Title 10 and other funds. And because we get Title 10, they may say that's why we may not be able to take the card. But those are the things I think, yes, we should look like into to figure
Yeah,
out what.
Let's find out. I mean, I think it's a fair question, and if we're not eligible and no health department
Okay.
is eligible, then we have our answer. But I see some value in people having their own health card and sort of saying, you know, I get to choose where I get my health care. And that's kind of an empowering feeling, I imagine, so.
So to go back to your original question,
Yes.
that wasn't anything that necessarily needed
So
action
I
in
don't think
this
we need, well, it won't be on here because we won't be in network
this year for
before
this.
the 31st of October. But it is on here so that we will know when we have to redo this. I think it's in the fees, eligibility, and billing.
Yeah. The next to last
That
page.
Oh, the next one. Yes. Yes, the attachment B. We need to make sure we can include Athena. And for the, you may need to change presently for the Medicare portion. Do we accept, like the tailored plans? So Trillium and, the other tailored plan?
Correct, yes, we do, so that does need to be.
So we need to add those two to it. Yes, we went from 5 to 7, so new plans.
So those two need to be added right now.
Yes, those need to be added now.
And what are the
Right,
names of
because
those two?
Trillium,
Trillium, we currently have a contract, we have.
so yes, on here, so Trillium should be on here under the North Carolina Medicaid plans.
All right, was there a second one?
The other Taylor, is it Alliance Taylor? Alliance Taylor,
Yes, ma'am. Those are the only two that we, contract with,
check with, right?
Okay.
because the others are not in our.
Yeah, they're not our area. So it's Alliance Tailored Plan and Trillium Tailored Plan.
I'm certain, 100% with Trillium.
Oh, I'm 1,000% sure with Trillium.
Alliance, I'm about 80% sure, but
Well, the reason I can say Alliance is in our area because we have kids here.
I know we did turn in the paperwork to be a part of their,
Uh-huh.
network, so I would have to make sure. I
Just
check
double check.
Dora, just to be sure that we were.
Okay.
Good questions and additions there, Dr. Singletary. Thank you.
You're welcome. See, I read through every little page.
Thank you, I'm glad there's not just putting stuff out there.
No.
I appreciate it.
Mm-hmm.
Any other questions?
That was it for me.
All right. So we are seeking approval on those.
I'll do it since I made the additions.
Yeah.
So, I, make a motion that we move, that we accept the policies, needed for accreditation, as submitted with the noted changes to, policy title, fees, eligibility, and billing policy, to add, the additional Medicaid plans of Trillium and Alliance Tailored Plan to attachment B.
All right. All in favor? Make it known by,
Oh,
well,
second.
I need a second on that. You got a second. All in favor, make it known by saying aye.
Aye.
Okay.
So, ask ask a quick question? Amanda, before you leave on the, I've heard the 31st date for the portal, kind of everything's got to be in. Everything will be in by the time you leave. Okay,
Deanna Blue is our accreditation coordinator.
okay.
So, she'll be coordinating everything and.
But
I'll
as far as
refer-
you know, everything will be in by then.
So as of November 1st, 80% for a good faith effort needs to be loaded into the portal.
Okay,
And I'm confident we'll do that.
okay. Very good.
Now,
Sorry,
when
there's
they
gonna be a
come-
new person and they're gonna be hitting the ground running.
When they come for their site visit, I think it's in March.
Yes.
They'll have questions for board members as well, right?
Yes.
And they'll do an interview with the director of nursing, health director, or consolidated director. Those are things that'll have to take place as well, but that gives you a few months out to work on that.
Gotcha. Okay.
All right, the next item on the agenda is approval of rollover funding AA 121 ARPA TS Public Health Services for $98,977. Is that a form that we have?
I don't think,
What's this one for?
Didn't
What
they
A
do it?
this one?
you didn't give,
I did not.
Deanna the agreement addendum?
The AA that we received last year and the previous year. It was originally $50,000 for the health department to perform, to get training and everything to perform. Once again, those 10 essential services for the health department required. And they gave us an additional 50 the next year, so it ended up being $100,000. And at this point in time, we did not know if they were going to roll it over into this year until later on. And they have given us that money, that $98,000, because we've only got the amount of money we spent. The actually money we've actually spent in this money was just to do some training for staff. So that's the amount of money that's sitting there. In order for me to be able to spend the money or to have a plan to spend the money, we have to have you guys approve it, and then the commissioners approve the rollover of the state money, which if you want a copy of the AA, I can get you a copy of the AA. I got it on my phone, but I just don't know how to get it to you other than that. Basically, it goes through and says the 10 essential services of the health department and what you're supposed to do to spend that money to make sure those things have not dropped off. This is part of that leftover COVID money that was kind of sitting out there for health departments, as in our other 117, is to support health departments because we lost so much stuff and structure during COVID that these grants are here to help us get back to that structure, to where we are, where we need to be, where we were pre-COVID. So that's what this money is actually for. And it's actually specific things that has to be spent on.
A question. I know you said it's specific things. It has to be spent on. Is it possible, since it is for training, that we can use these funds to help train all the new people that's about to come in with the consolidation? If it's for public health.
For public health employees,
Yes, that's my question. That's what maybe we should,
training is one of those.
For the employees,
for,
but not,
Employees and public health.
that's what I'm like,
Not for-
so, we have,
A lot
all
of
these good
vacancies.
openings that we have, right? So can these funds be used to train those employees that we,
My plan is to, with this 1721 AA
Mhm.
and the 117, which is about $200,000, that is specifically catered or specified to public health infrastructure, which includes retaining bonuses, sign-on bonuses, everything of that nature, training, everything. My plan, my thing I'm trying to do is I'm going to, because my finance officer, I talked to Mickey Butler about these funds that I had, and she said, Tim, sit down and you make a plan of how you want to spend this money, and you make a plan on how you want to spend this money and get this money rolling, then we have something to go forward with, and we can actually take that plan to
Yeah.
the board, or we take
Yes.
it.
and some
That's
of
why
this
I'm
is a-
asking, because I want to make sure it's on, everybody might, we can, instead of having to go into county money or asking, if we have funds to train up these people that we know we need to do these 10 essential services that right now we may be.
And that's
short
with,
on.
AA 121, but Tim mentioned the
The other
AA
217.
117, which is the public health infrastructure money. That
Okay.
is the one that we talked about last year, and we had a plan for sign-on
Okay.
bonuses
okay.
and incentives
Ah.
and
Okay.
to pay staff when they were working on Saturdays,
Community
take mobile,
events.
and it was denied.
Okay.
That's the same funding, so the money's still sitting there.
It was denied by the grant,
No, it was denied by the county manager.
but it
Because
could,
they wanted to be consistent across the board. They said, even though that's public health money, if we gave bonuses, make
But
sure
it
I'm
could have
telling
been-
this
but it
right.
could have
Remember
been-
Oh,
when
yeah,
we
I got
met
it in my
with them?
notes. Mhm.
I tell you what,
Hey,
I will help with this one.
Yeah.
It, just hearing that limited story, I'd say I don't agree. So we need to find a better way. Because we're looking at paying bonuses for some hard-to-acquire skills. So I don't think it's out of the question. And if you have money to do it, I'm sorry, if it
That's why I'd
only
be like
affects public.
$300,000 right
Yeah,
there.
and just because it affects public health and not another department really shouldn't matter.
it should,
Well,
yeah.
Dr.
It should be
Singletary and I had met with,
But he said he's gonna back us up for
Yeah,
what
I tell
we
you what,
said.
I'll take that on because my goal is by April of next year, we are 100% staffed.
But if you've got funding.
We've
if you've
got to
got
get
funding,
serious about
you should-
this.
You should spend
yeah,
it.
because
you
we
might
That's
have
what he
not
said
had
he
some
gonna
you might
fight
not
for.
get funding the next time.
candidates,
That's what he gonna fight for.
but not
So
being
he's
able to
fighting for
spend
it.
that money to
So that's what
get
I'll
them in
take.
the door, then
Well-
they back out.
This is the first I've heard of this particular discussion, so this is just my initial reaction. Are we going to have this ready for the commissioner meeting the 1st of November? No, not the proposal, but the request to approve these funds.
Yeah, so when we're voting now to approve.
So we're going to vote now, and then you'll have this ready for our meeting. Okay. Yeah, I'll take this on. And the other thing, though, is I think, just to build on Dr. Singletary's point, I think we need to meet with HR, and we need to figure out what is the right, is it a retention bonus, is it a sign-on bonus? What job should it affect? I mean, we need to have a bigger plan, because this is not one of those you just throw money at. You gotta be effective, so. Well, I don't know about you yourself, and I'm gonna talk to Amanda Holland about this as well, but I think getting this money laid in is gonna be step one. Then step two, I think we do need to have an interaction with HR, Amanda Holland, other key players, whatever they may be, and let's come up with something that works, because sign-on bonuses are okay, but retention bonuses are better, right?
Yes.
I mean, there's some smart stuff you can do, and, you know, if we have money to do it and it's for this express purpose, why in the world would we not use it is my initial reaction, but I'll take this fight.
And I think they can give you the specifics on the AA 117, because that is the one where it's about like close to 200,000 that the
It's
state
over two.
approved. Huh?
It's over 200,000.
Oh, it's over 200,000 now, that the state approved for those type things.
And I'll be happy to email that to you tomorrow, so you'll have it to look at.
Yeah, I'm struggling to understand why we wouldn't do that to some extent. You know, we don't spend the whole 200,000, but we spend makes sense and what's sustainable and what's fair. So, anyway.
So first thing first,
Let's approve
I'll make the motion to approve the rollover funding for AA 121, ARPA TS, Public Health Services, total of $98,977.
I second.
All right, all in favor, make it known by saying aye.
Aye.
Aye. All right, that is approved. I think this one,
Chair, I will make note that $200,000, 121 that we're speaking of.
117.
117.
117, I apologize, 117, I got all the numbers in my head. 117 is in a budgeted line item in our county, in our health department budget. So that expenses for those funds are in a budgetary line item.
And right now, now, the only money that's being used out of that is for the employee recognition, award that we set in place. To where every month-
It's already in the budget, the expenses and the revenue's already there. All
We just have to be
spent.
approved.
That's okay. I just, like I said, let's just come up with a plan. We know we have money. Usually we have a plan and no money. Having money already, we can build a plan. So, yeah.
Good deal. All right, so now we're gonna look at approval for funding, additional funding of AA 510, General Communicable Disease Control, $6,000.
Yeah, they gave us an additional 6,000 that, we didn't know. So this is an additional funding, not a rolling.
$6,000, the state is looking at currently going to electronic lab system, basically where instead of sending stuff in a certain, still have to send things in a certain way, and you have to send labels in and that stuff. Basically, what they're looking at is sending things to an electronic system now, state lab is. So this $6,000 is to assist our agency with coming up to buying the equipment and buying things to be able to print labels. Instead of us typing our own labels, they'll actually have a printer that we can print labels out of. So that $6,000 is to help us transition into the state lab going basically online.
Okay.
Any questions there? All right, well, I will make the motion to accept the additional funding of AA 510 General Communicable Diseases Control for the $6,000.
Second.
I second.
All right, we got a second, from Dr. Hughes. All in favor, make it known by saying aye.
Aye.
And that passes unanimously. The last item on our agenda is a little recognition for Ms. Deaver. We are very thankful as a board for your handful of years here serving Scotland County, but we also acknowledge your career in this sector of public health, and we thank you for a job well done. We thank you as a board. We're very thankful for your efforts and all that you've done, and I wish you the best in the next chapter of spending time with that grandbaby and going on vacations and wearing Crocs every day.
That's right. Sweats and jeans.
And we want to present you this certificate for your
Oh, that's nice. Thank you.
all your efforts, and then we also have
Oh,
a little award.
that's beautiful.
And we would like to ask the board to come in front and get a picture. And
Yeah.
Want me to wear it for you?
So it says, thank you, presented to Amanda Deaver. Congratulations on your well-deserved retirement after 32 years of outstanding service in public health. In sincere gratitude for the loyalty, perseverance, and friendship you've given us over the years. You've led by example, set the bar, and made a lasting impact that we will always cherish. As this chapter of your life ends, may a new and exceptional one begin. October 2025, from your colleagues at Scotland County. You gotta go stand in front of the table. You can't take a picture behind the thing.
do you have a different slide we could put up in the background? of our photo? Oh, yeah.
Oh, I can just exit it out. Oh,
Yeah, that's fine too.
I can edit it.
All right.
Now I want you to stand right here, and I want all y'all to come up. We were wondering if y'all were gonna stay to the end because we was planning this. We didn't know. Baby D. Come on. Come stand beside your wife. Thank you, sir.
How many spots?
There we go.
Thank you.
This one I call it a mama.
the exact same one. Oh, my daughter bought me these. Yeah, her granddaughter.
I've just over her child.
Oh,
She's every bit of 80 pounds.
you can never have too many
She
grandkids.
says she's 100, but I don't believe she's
Yeah.
100 pounds.
All right, with that, I'll just open the floor to any general comments, questions from the board here. All right. Well, I will make the motion to adjourn this last Board of Health meeting in its current form. And we'll see, hopefully, all of us in the new format. So thank you all.
The next meeting date is,
December.
Hold on.
Let me look on my calendar.
Look.
Get yours.
Yeah, I can pull that.
16.
Yep, December 16th.
December 16th?
Mhm.
Okay.
Keep that dog-eared and look forward to more communication about what will happen on that date,
Okay.
if anything. So keep that reserved.
Okay.
But I'll make the motion to adjourn this evening.
Second.
All in favor?
Aye.
Aye. All right, thank you all.